Missouri Republicans are blocking key funding that would provide thousands of low-income workers with health insurance. Last year, people in Missouri voted to expand Medicaid under the Affordable Care Act. It expanded eligibility to those who can't afford coverage but earn too much to qualify for the state-run program. But last week, Republican Governor Mike Parson formally withdrew the plan. He says the state cannot afford the expansion after the GOP-controlled legislature refused to fund it in their budget. For more, let's bring in Jeanne Kuang. She is a Missouri State House reporter for the Kansas City Star. Jeanne, welcome. Thanks very much for being with us. Can you first provide us with some context on who stood to benefit from the Medicare expansion in the ballot measure which passed?
Yeah, so Missouri's current Medicaid program has one of the lowest eligibility thresholds in the nation. Only pregnant women, children, the elderly, and the disabled qualify. Very few adults without children qualify for Medicaid right now. So the expansion would have covered adults earning up to 138% of the federal poverty level. In 2021, federal poverty level, I believe, is under $22,000 for a family of three. So that gives you an idea of the people that would have qualified. And the governor's administration has estimated that this would be about 275,000 low-income Missourians that they expected to sign up under the expansion plan this year.
Well, Jeanne, what type of blowback has the governor and Republican legislature received for blocking a priority that voters said they wanted?
Yeah, I mean, they've been getting some pretty harsh criticism over it. The Democrats obviously have come out with some pretty strong statements against it, and proponents of the expansion who put this on the ballot have pretty much promised to file a lawsuit. They have put the eligibility governing, who's allowed to get on Medicaid into the state constitution now. That's what the voters voted on last August. But, the decision of whether or not to pay for that was basically still in the lawmakers' hands. And so Governor Parson has essentially said, this is just a legal problem. It just has to go to court. So we're pretty much looking at an almost certain court battle at this point.
Well, a new CBS News poll finds half of the Republican Party nationally is divided on whether it should focus on new policies to win over new voters. 47% say the GOP is big enough and should prioritize changing voting rules instead. So, Jeanne, how are Republicans there justifying blocking this Medicaid expansion, and do they have the constitutional authority to do so?
Well, when this issue went to a ballot measure last year, there was a court case over or not this language could be added to the ballot. The state's constitution says that voters can't, using a ballot measure, decide whether or not the state appropriates money or spends a certain amount of money. And because the ballot measure didn't raise a new tax for it or anything like that, the judge said it's fine, this can go on the ballot because it's not directing the state government to spend money. Only lawmakers can do it. And so Republicans who have been pretty open that they've always opposed Medicaid expansion, they've been using that argument in the legislature this year to refuse to vote for the funding. I think that will be the key issue that will be decided in court. Just kind of, the eligibility is in the Constitution now, but so is that provision that says that only lawmakers can decide whether or not to pay for something. So that's, the eligibility just kind of conflicts with the funding issue. And I do think that the Republican lawmakers also have lots of philosophical objections that they haven't been quiet about in terms of opposing Medicaid expansion, but they have been using that kind of constitutional conflict as it relates to the funding in order to push back on actually implementing the expansion this year.
And Jeanne, before we let you go, I know you have been following closely the battle to renew a tax on medical providers there. Besides for the Medicaid expansion, what else would be impacted if lawmakers don't reach a deal?
Yeah, so in addition to the issue of funding the expansion population of Medicaid, there's also been a fight this year in the legislature to renew an annual medical provider tax on hospitals, pharmacies, nursing homes that helps draw down a ton of federal money that pays for a bunch of the existing Medicaid program. They did not end their legislative session with renewing this tax, and it expires on September 30th. So, that is a huge chunk of funding for the existing Medicaid program, and a lot of the nursing homes and hospitals say that they could be really seriously financially threatened without this. The entire Medicaid program is at risk without this tax. So that's been just a kind of separate fight that's been going on at the same time as the fight to actually pay for the expansion population as well.
And what are those groups, Jeanne, saying that they're going to do if they're going to be in such financial dire straits? What happens?
I think everybody still hopes that they're able to deal. They're hoping that the governor will call a special session before the tax expires at the end of September in order to just pass the renewal. Right now, the renewal is sort of caught up in a conservative effort to tie it to a ban on Medicaid coverage of certain birth control options. And there are a significant number of Republicans who do believe that that should be a separate issue, and that they should just go forward and renew this tax and keep the state's Medicaid and the existing program running. But I think this was all caught up in a lot of interpersonal fighting, both amongst Republicans and between Republicans and Democrats towards the end of the session. And so I think a lot of the advocates and the representatives of the healthcare industry are hoping that, maybe if we just kind of hold on for a month or come back to this, in a few weeks, maybe cooler heads will prevail and that everybody will be able to reach a deal. That's kind of where the temperature is at right now.
All right, Jeanne Kuang for us. Jeanne, thank you very much.
Thank you for having me.